Professor Victor Grech is a doctor, pediatrician consultant with a special interest in cardiology and is the president of the Beating Heart Foundation. He has been following the coronavirus very closely and has even created a website to update the public on recent cases and, more importantly, to provide the necessary awareness of what is happening and how serious this is, because this is very serious. And I know Professor Victor Grech, and when he's going to create a website about something, it is definitely serious. The website is sponsored by the Institute of Technology, Humanities, the Arts and Science, and the web URL is ethams.com/COVID-19 /. So that is ithams.com COVID-19. The site's data is based on evidence-based medicine and known facts. Victor, thanks for joining me on the Real Estate Conversation. We have some history together. We have done some charity with Beating Hearts Foundation and the Remax and Friends Foundation. I know when you take something serious, it's serious. We are facing uncharted territory, and it is important that we, as the public, know the facts. People are petrified and taking every precaution to avoid contagion. Others, let's say, are not taking it that serious enough. Some may be questioning, why are we here on the Real Estate Conversation? But in fact, my answer is it has everything to do with the real estate conversation because every industry is facing the same challenges. We all need to earn a living, no matter what career we're in. We have children, most of us, and many of us have vulnerable parents and grandparents. Victor, why should we take this coronavirus serious?
The coronavirus is going to put 15% of us in hospital and 5% of us in intensive care. These are the statistics as relayed from us by the World Health Organization from experience in China. And if the cases come too fast, too hard, then our intensive care services will not cope. And like exactly what's been happening in Italy over the past few days, when they've seen a sudden surge in northern Italy of cases, and this is northern Italy, Bergamo, the most affluent part of Italy, with excellent health services, and they were overwhelmed. So they came to the point where they did not have enough machines to ventilate and take care of all their critically ill patients. So patients died simply because there weren't enough machinery and staff, ventilators specifically, to take care of critically ill patients. This is what we do not want to happen. This is what Minister Chris Fearn said in the interview he gave to the Times this morning. We are trying to commit ourselves to treating each and every patient that needs critical care treatment, or any kind of treatment for that matter. But for that to happen, we need to slow down the spread of this virus. Because the virus is going to be with us for a long time until we get a vaccine. The vaccine will realistically take 12 to 18 months to be in hand. So we need to be careful. There may be surprises like an early vaccine. It's possible, but any vaccine needs to be tested. There may be surprises with newfound cures. We can hope, but we cannot possibly base any decisions on what might happen. What we know will happen is this is going to spread, and we need to spread it as little as possible and as slowly as possible so that we can cope at hospital with the more serious and the critical complications.
During our chats, you have told me endless times, and it's the first thing you told me, stop smoking. What is the reason why a smoker would be affected more than the non-smoker?
Jeff, have you stopped smoking?
I'm trying.
You're trying. Okay, that's a start. You've reduced.
Yes, I have.
Good. Okay. Now, there's been quite a few thousands of people infected. So now we have a fairly good idea of who is more vulnerable. If you actually go on the website, and we'll give you, Jeff has given you the link, and we'll give you the link as well later on the video. There's a summary of what makes this worse. So things like having lung disease, like being a smoker. That's like self-inflicted lung disease. Things like obesity, like diabetes. There's a whole list of things which can increase your risk of making this worse. One other thing is obviously age. And we know with age, you tend to get what we call in medicine comorbidities, which is just a fancy word for saying as you get old, things start going wrong. So, you're old, like happened in Italy. You're old, you have heart failure, diabetes, you can have a number of things, and any of these singly, especially, and obviously, of course, in summation, can make things much worse for you, which is why we're telling people to stay away from old people, especially, well, stay away from everyone, but the elderly especially should be protected by being kept in isolation. I haven't seen my
Okay.
parents in 10 days. C'est la vie.
All right. Grandchildren, grandparents, they have to
Yeah,
stay
keep
away
them
from,
away.
keep them
Keep them
away
away. This
completely.
is one of the reasons why I said they had such a disaster in Bergamo, in Italy, because this extended family in Italy is very, very strong, like it is over here. So the grandparents take care of kids, the kids are sick, they give COVID to their grandparents, and the grandparents die. It's a very simple equation. So small children, especially, should be kept away from
Oh,
grandparents. And what's even scarier about this is that the kids can be completely asymptomatic. No fever, no cough, no sniffles, completely well and shedding virus. So the parents and the grandparents are very, very vulnerable.
okay. So let's say my case, grandma lives with the family.
Yeah,
What's the case? What do you do?
it's difficult. Essentially, the kids are to some extent protected because now they've been in isolation away from school for a while. So if they've been cocooned away from everyone, they're unlikely to be carrying it. If you guys have isolated yourselves at home and have minimal contact with anyone, your mother-in-law should be relatively
She
safe.
should be okay. But I'm seeing articles that how irresponsible people are being, packed car parks. In fact, a fellow colleague of yours made a plea to the public to stop gathering and going in places where others congregate. What can happen if this carries on? And what would be the worst case scenario?
On the website, I've put in some calculations, which are not conjecture. They are based on the numbers that we have published by the World Health Organization from the experience we have in China. So this is not something I've made up. I've just done the calculations based on the local population. So it's a very, very simple thing to do. And the tab in the website is called numbers. Worst case scenario is we have a huge spike and say 60-80% of the population becomes infected over the span of 2-3 months. If that happens, just by the simple 15% 5% rule, the hospital will just be flooded. It will be very difficult for us to take care of the patients, and we healthcare workers are mortal. We can also get sick. And if we get sick because of sheer exposure, despite the protective clothing, or because we're tired and we make mistakes, then the public is going to find itself in an even worse situation because there will not be enough healthcare workers to take care of the sick.
In fact, I saw an article in the New York Times that New York City, they're already running out of the
Ventilators, yeah.
ventilators.
In England, messages from colleagues. Well, in Italy, they've been going through this mess since a week, 10 days. In England, in London, which is the epicenter of the UK's infection, I've got all these links up on the website if anyone wants to look them up. They're also struggling hard. Um, People are coming up with innovative ways of trying to cope, like hooking up several patients on one ventilator, something that I didn't know was possible until a couple of days ago, but it can be done. Again, I've posted the links up from my website. Not that we hope it will come to that, because you still need sheer huge numbers of manpower just to cope with this kind
Yeah,
of.
I mean, we will be showing the website on the video that we're presenting now, and we will put the link inside the article and the on our YouTube channel. Remax, as a company, we have decided to work remotely from home by providing our agents access to our database and other tools to remain active and to continue to stay in touch with their contacts.
I wish everyone would do the same.
Yeah.
Proceed.
We have also created a whole new curriculum from scratch because this is uncharted territory. People need to know how to cope and learn how to effectively work from home,
Yeah.
how to deal with their children during this period of time.
Yeah.
And we're also doing webinars and so forth to help them cope during this period. We're also going to be giving them fitness tips and activities to
Yeah.
do with the family. Our team has been working endless hours and they've done an amazing job. In fact, tomorrow we'll be launching the whole new curriculum. We're going to do a webinar to all our agents, all 400 of them, to explain what we intend to do over the next few weeks. Obviously, we don't know how long it's going to last. So our team is, every day we're working on Zoom, obviously remotely. And we see a lot of, how do you say, where everyone's coming together. And it's great. Agents, though, there is business happening, we know. Because there is no lockdown at the moment, some people still want to see properties. Our guidance is that it's discouraged. But if there is a case where someone had a total urgency, like we know that some people arrive in Malta and they don't have a place to stay,
Yeah.
yes, we do have to show and give the service. But we're also recommending that if they're going to be showing a property and they have a chance to video the property before they actually show it in person, it's better. So we have come up with these ways to avoid contact and obviously social distancing. What is your take on this scenario? And even I would say it probably also works for sales companies that sell goods and other companies. What do you think about?
Absolutely. I had this discussion with someone who works in a law firm the other day. Now, this applies not only to a state agency, but to anyone who, at some point, because of the nature of the job, needs to come in contact with other people or needs to go in an office. So, like you said, it's essentially common sense. If you need to go into an office, since many people are teleworking, there's going to be a big office relative to a small number of people. So, sensible thing to do would be to go in on a roster basis, because whatever you need to do in the office isn't going to be entirely in the office. Now, when it comes to people like estate agents like you, I mean, you'd be daft, let's face it, to buy a house or a property without actually seeing it. So, yes, you should prepare the material beforehand so they can have a very good idea of what they're going to see. So then not a lot of time is spent actually physically on the property. One stays in distant contact from the other persons who are viewing the property or who are with you. One does not cough or sneeze in their faces, keep 2 meters
Do face
distance.
masks help?
Ideally with a face mask, yes, that's debatable whether a face mask helps or not. But anyway, stay 2 meters away. It's going to be a property, so there's going to be a whole apartment at least with 2 or 3 people in it. So relatively safe. No handshaking, no hugging, even with someone you know before. And finally, when you leave, you go home and you wash your hands with soap and water.
I would say no touching surfaces. I would
Yes,
say,
touching surfaces. But if you do touch surfaces, because sometimes you have to, door handles,
yeah.
yeah, knobs, whatever. I mean, just wash your hands and don't put your hands anywhere near your face until you wash your hands.
Okay. Thanks, Victor. Um, we've almost covered everything. So, how can the audience help stop spreading the coronavirus? What is the perfect scenario? Can you provide some general guidance to everyone?
So, general guidance, if you need to go out for the essentials, limit your exposure to people. At all costs, avoid exposing the elderly or the sick to yourself or to others. Very strict hand washing rules. Gloves are not terribly useful, they give you a false sense of security. Soap and water is even better than a hand sanitizer. This virus is a bit of an amateur, so even some soap and water more than suffices. Do not put your hands near your face. Only go out for the very important essentials. When the shopping is delivered to your house or when you arrive home with the shopping, just tuck everything away and wash your hands again. Preferably buy fresh fruit and veg, which has to be peeled. So after you peel it, the surface is cleaned, and then you just wash your hands and Bob's your uncle.
Bulk buying. Should people think 2-3 days ahead, a week ahead?
Oh, I would. We're not going to run out of food. I mean, this
Yeah.
panic buying, especially the toilet paper. I mean, what is it I just do not understand the toilet paper issue. I mean, I can understand wine and beer, but toilet paper. Come on, toilet paper. What the heck? But
But
anyway, who
I
am I
would
to
say if you buy for a week, you're limiting your outings as well. So
Yes,
that's
yes.
probably what people are thinking.
No, people are hoarding. I mean, God knows what they're hoarding to. I can understand beer, but toilet paper.
Thanks, Victor, for being
My
on
pleasure.
the real estate
Anytime.
conversation. Again, Professor Victor is a pediatrician, cardiologist at Mater Dei. He's a lecturer at the University of Malta and a philanthropist.
Ooh. Thank
Wow.
you. See you, Jeff.
Thanks.
To the
Cheers.
next beer. Ciao, ciao.
Yes. Ciao. See you soon. Thank you so much.